channel. If you're new, my name is Alexis. I'm glad you're here. So, as you can see, I have a different background if you're used to my videos. I got a new vanity mirror and the lighting is so good, so I was like, I might have to start filming in my bedroom, but we'll see. Also, I'm wearing my scrubs because I have to go to work in about like an hour or so, but I figured I'd just make a video before I go to work. And today we're going to be talking about what it's really like to be a NICU nurse. So my last nursing video was about basically my typical shift as a NICU nurse, but now we're going to go into a little bit more detail about other things about the job. And I kind of have a lot to cover. I'll try to not make the video too long, but I brought out my tablet just in case I forget something. So we're going to go ahead and get started. So first, I do want to talk about a misconception of the job. I think when a lot of people hear NICU, they just immediately think babies, and they kind of forget that the NICU is an ICU, even though ICU is in the term NICU. So because it's an ICU, it is very serious. We see critical patients, and it can be very busy. Things can change like that, so you kind of just never know what to expect. And so basically, if you are interested in becoming a NICU nurse because you just want to like stare at cute babies and play with them and rock them all day, hate to burst your bubble, but that's not what we do. If you just want to play with and hold babies all day, you should probably work at a daycare. The NICU is a lot more than that, and actually as a NICU nurse, it's very rare that we just get to sit and hold a baby for quite some time. A lot of our babies can't even be held, so yeah, that's not really what we do. So let's talk about the types of patients that we see in the NICU. Sometimes we have patients that we consider to be stable. So these are usually the babies that are just working on gaining weight or PO feeding. They don't really have anything too serious going on. On the other hand, we have very critical patients. Patients who are very sick, very premature. So some issues that they may have will be like GI issues. So you may see babies with an omphalocele, gastroschisis, or neck. Sometimes we have patients with respiratory issues, so they may have a nasal cannula in, they may be on bubble CPAP, they can be on a conventional vent, so they're intubated, or they can be on the high frequency vent, so that's the jet and the oscillator. Some patients with respiratory issues may have a trach in. Let's see what else. We may have patients who need help with their feeds. So some patients may be in PO and not eating at all. Some may have an OG tube in, an NG tube, or a G tube, and they're getting fed with a pump. Sometimes we have patients with skin issues. So a lot of babies may be jaundiced when they're born. So they have high bilirubin levels and they're under phototherapy lights. Also, skin issues may be like rashes, or patient may have a teratoma. They may have just birth deformities like an extra digit on their finger. Maybe they were born without an eye. There can be a lot of different issues that we see. Also, patients may have an IV, a PIC, a UVC, or a UAC, just different lines. They may have TPN running, or lipids, or whatever other medication they may need going through those lines. We take in patients at a wide range of gestational ages, so some patients may be preterm, so they can be about, say, 24 to 36 weeks. They may be term, so 37 to 40 weeks, or maybe even post-term at 41 weeks. Also, our patients have a lot of different weights, so some patients, like especially the preterm ones, may be under 1,000 grams and they can just fit in your hand. Other patients may be average weight, so like 6-7 pounds, and every once in a while we'll have a large for gestational age baby that was born at 12 pounds. So you see a very wide variety of different types of patients. You kind of never know what you're going to get. Also, some babies cry a lot, some don't cry at all, especially the ones that are like intubated. Of course, you're not going to hear them cry. Also, we may have some patients that have seizures sometimes, or patients that don't move at all, so they may be under continuous video EEG monitoring. So that's just kind of a short general list of what we may see in the NICU. If I listed everything, this video would take forever, and like I don't have time for that, and you guys don't have time for that. So now let's talk about the length of stay for our patients. Some patients may stay for just a few days. These are usually the more stable ones that are just working on their weight or PO feeding it. Some patients may stay for weeks or months, which is more common, and every once in a while we may have a patient that celebrates their first birthday in the NICU. That's a little more rare, but it can happen. Of course, our patients just have to stay with us until they get better or until they can be transferred to another floor. So let's talk about the types of beds that our patients use. The NICU is pretty different in the fact that our patients don't usually stay in one bed during their entire stay. So in the middle of filming, my camera shut off because I ran out of memory. So let's rewind a little bit and go back to what I was saying. So our patients are usually in more than one type of bed during their length of stay. When they're born, we often have patients come over on radiant warmers. So these are beds that are pretty much open. Of course, they have side rails, and on the top there's a heater to keep the baby warm. And you can set the radiant warmer at different temperatures. You can weigh the baby on it. You can raise and lower the head of the bed. So that's just one type of bed. We also use isolettes a lot, and we also call these incubators. So these are the beds that are enclosed on every side, and then they have the two holes on the sides that you stick your hands through. And you just kind of have to maneuver through those two holes. So these beds also keep our patients warm and help regulate their temperature. And when we have what we call ELBWs, which are extremely low birth weight babies, we also put them in there because they have very fragile skin. And with these beds we can set humidity, which helps with their skin. And these beds also have a bunch of different buttons and settings. You can weigh them and raise and lower the head of the bed too. We also have open cribs, and I'm sure you all know what a crib is. Nothing special with that, it's just kind of like a crib at home. These are usually for our more stable babies or our older babies who of course can regulate their own temperature. And then we also have what we call bassinets, and we don't use these too often. They're usually for our patients who will be going home in like 3 days or so. And every once in a while we'll put our patients in swings, which of course aren't beds, but we'll put them in there if they're cranky, or I don't know, some patients just really like the swings. It keeps them calm, it helps them fall asleep. They really like it, we like it, so sometimes we'll put them in there. Alright, so now let's move on to the duties as a NICU nurse. Of course, hand hygiene is everything. You have to scrub your hands when you go in, and you put hand sanitizer on so much. Like if I had $1 for every time I put one hand sanitizer in just one shift, oh my gosh. So you want to put hand sanitizer on before you touch your patient. If you touch your computer or your cell phone, make sure you put hand sanitizer on before you touch your patient again. If you go from one patient to another, you need to put hand sanitizer on so that you're not transferring germs. So hand hygiene is everything. Also, of course, you need to learn all the policies. You need to know how to do things, when to do it, why we do it, how long you need to do it. So there's just so much to learn, but that's with every unit, of course. So also, of course, you have to do your head-to-toe assessment. So that involves checking fontanelles and sutures, auscultating heart sounds, lung sounds, bowel sounds. You have to do an abdominal girth. Sometimes we weigh our patients, do a head circumference, measure their length. We check residual. There's just so many different things that go into the assessment. You obviously want to check their skin, make sure you reposition your patient every few hours. All that good stuff. Also, as a nurse, of course, you need to give medications. We pretty much give the same medications. Every once in a while we'll have a patient with a certain condition that requires a special medication, but we usually give caffeine, multivitamins, iron, nystatin, vitamin A. When a baby is born, of course, we do the erythromycin for the eyes, and we give vitamin K. Before a patient is discharged, we have to give a Hep B shot. So the list for medication goes on and on too. Also, as the NICU nurse, you have to insert IVs. If an IV is saline locked, you're going to flush it. You may have to take out an IV. Let's see. I have to look at my notebook or my tablet because I can't remember everything. It's just such a long list. Let's see what else. Oh, well, the obvious. You definitely have to feed your patient if they're not NPO, so you can bottle feed them or you do their feeds through the pump. You also have to change diapers, change sheets and linen. Sheets and linen, change their sheets, change their clothes. You may have to give a bath. Sometimes we have admissions, sometimes we have discharges. You may have to take your patient down for an MRI or a VCUG or whatever else they need. Sometimes you have to take them down to the OR for surgery. There's just so much that you have to do. You just never know how your shift is going to go. A lot of times we have labs, so we usually do Hill sticks to check sugar or to just get little vials of blood and we send that off to the lab. One thing that I really want to add on that I forgot is that you want to make sure you can see and hear the alarms in the monitor at all times. A lot of times we get what is called alarm fatigue. So in an ICU, you're constantly going to hear beeping and alarms going off, but you have to make sure you're paying attention to these at all times because they're there to let you know that something is changing or something's happening. It's there to get your attention and you need to pay attention. You also want to make sure that you can see and hear your patients at all times, and if you ever have to step out of the room, make sure you let another nurse know that you're leaving and let them know what's going on with your patient just so they'll be aware. Also, make sure you always do your emergency checks. You want to make sure your patient's neopuff is working so they have oxygen and that they have suction always working. Make sure their rails are up so that they can't fall out of bed, of course. You don't want that to happen. Make sure their beds are locked so it's not rolling everywhere. Just be very careful at all times. Another job that you have as a nurse, unfortunately, is to do end-of-life care. Sometimes you have to withdraw care from your patient and get ready to, unfortunately, take them to the morgue. So that's sad. Thankfully, I haven't had to do that yet, but I have seen some of my coworkers do that, and it's just an unfortunate part of being a nurse. Sometimes it happens, and it can be really hard. So as a nurse, make sure you're also taking care of yourself. We often get attached to our patients because, like I said, the length of stay can be very long for some of our patients. They may be here for months, and if a patient happens to pass that you've gotten, attached to, it can be hard on yourself. So make sure you are taking care of yourself and you're learning how to cope with loss. In addition to you coping, of course, you want to help the family members who are there coping with their loss also. Another important thing that you have to do as a nurse is to both comfort and educate parents. So of course, nobody wants their baby to be in the NICU, nobody expects it, but it happens. So a lot of times parents may come in, they're overwhelmed, they're sad, they're crying. So of course, as a nurse, you want to comfort them, be a listening ear, a shoulder to lean on, all of that. And a lot of times parents come in and it's their first baby, so we teach them how to change diapers, how to properly hold their baby, how to breastfeed. It's also very important that you explain things as you're doing them to parents. So when we have care times, a lot of times we like to involve parents. We'll let them change a diaper or check temperature, but when it comes to things that you have to do as a nurse and parents aren't allowed to do due to safety issues, of course, you just want to explain it to them as you do it, so they're not just sitting there in the dark, confused and not knowing what's going on. Also, you want to explain what's on the monitor, so you'll be like, oh, this number is the heart rate, this one is the respiratory rate, or this is the blood pressure, or we want this number to be between 1 and whatever. It's important to let them know what ranges you want to keep certain numbers in, just so they know what's going on. Another important task that you have as a nurse is to collaborate with the care team. So that is the doctors, nurse practitioner, respiratory therapist, dietitian, lactation consultant, chaplain, anyone that's involved with taking care of your patient, you need to collaborate with them. It's very important that you're present during rounds so that you're updated and you know what the plan of care is. Also, if you see a change in your patient's condition or just something doesn't look right, you want to notify the provider. As a nurse on any unit, you want to advocate for your patients, but I feel like this is especially important in the NICU because obviously our patients can't talk. So your patient is going to be like, hey, nurse, look at my belly. It's really tight. It's gotten bigger. It looks blue now. Please go get the provider. That is your job as a nurse, to check the abdominal girth, and if you see it's gone up by like 2 or 3 centimeters, you want to go let the provider know. If you check the residual and it's a weird color, something just doesn't look right, let the provider know. That's very, very important. And of course, you want to chart everything. Your day can get busy and you may end up staying late to chart. You may end up working a 13-hour shift, but you have to document everything, because every nurse knows that if it wasn't documented, it didn't happen. So you want to cover your butt and make sure you document everything. So I think that's pretty much everything I wanted to cover. Of course, with any job, being a NICU nurse, you're going to have ups and downs. Some days you're going to be like, wow, that was a really hard shift. I can't believe that happened. I was overwhelmed. Other days you're going to leave and you're going to be like, oh, I had such a great shift. I just love my job. So you just never know what to expect. I hope I covered the most important and common points. I think I did. But of course, if you have any questions, feel free to leave it in the comments and I will answer them. If you found this video to be helpful, make sure you give it a thumbs up. And also don't forget to subscribe if you are new. Also, if you're looking to be in the NICU one day, I say go for it. I love my job. I think it's like one of the greatest jobs ever. So continue to do your research, study hard, and if you want to be in the NICU, you can do it. You can do it. I believe in you. So I have to finish getting ready for work. And as I always say, I hope you all have a lovely day. Bye.